Dr. Deborah Birx is the coordinator of the White House Coronavirus Task Force, and she has been traveling the country encouraging people to take necessary steps to protect themselves and stop the spread of the virus. I spoke with Dr. Birx earlier today. Right now, I think many of us are just trying to wrap our heads around record numbers of cases and deaths, some alarming numbers. How would you characterize the rise in cases that we're seeing with the virus right now?
Well, the rate of rise that we're seeing right now is greater than the rate of rise that we saw either in the spring surge or the summer surge. And so this is a very serious situation. And that is compounded with the fact that we're not seeing improvement in the rate of rise. So that tells me that we have to do more. We have to do more as an American people. We have to do more state by state. But we know what to do. And it really is about telling every single individual what they need to do in order to protect themselves, their friends, and their family over these next 45 to 60 days while we get vaccines to the most vulnerable and those who need it the most.
Hospitalizations have hit an all-time high. Is our medical system prepared for what lies ahead?
I was, of course, across the upper part of the United States to about 11 states in the last couple of weeks. And I will tell you, the healthcare providers on the front lines, the doctors, the nurses, the respiratory therapists, they are working their hearts and souls to protect the people across America. And I guess what I'm asking every American to do is to put that same level of effort into those things that we know work now. We want those hospitals available not only for the individuals with COVID, but for your child if your child develops appendicitis, or for your father when he develops a heart attack. And so this is not just about COVID. This is ensuring that our hospitals stay functional for all the other medical conditions in the United States as well as COVID.
Have you been approached by the Biden team to be part of the task force for the coronavirus moving forward?
You know, I've been in government for 40 years, and I've been through 6 or more administrations and changes in administration, and I know that there's very strict rules about who and how people can be contacted, and so I'm sure they are following the rules, and no, I have not been contacted.
Would you like to continue your role in a new administration?
Obviously, I've worked in every administration since President Reagan, and it's been wonderful to serve this country in any place where people thought I could be useful. And so that's how I have served my entire life. You know, if people thought I could be useful, I am happy to understand how I could be of help.
Is it a worry of yours that if these guidelines are not universally followed, we could be headed to more lockdowns?
Well, you know, that implies that lockdowns will work. And I think if Americans are not wearing masks, they're not going to listen to us about staying, or they'll be socially gathering in their households. And so each of us have to take that kind of personal responsibility. We shouldn't have to have a lockdown to convince us that we know how to do the right thing. We can do the right thing. We can change the amount of viral spread. We can protect millions and hundreds of thousands of American lives over the next 4 to 6 weeks while we work on getting vaccines approved and distributed. This is not asking people to change their behavior for the next year or two. This is asking them to change their behavior for 45 to 60 days until we can get vaccinations out to those who need it the most.
And in terms of the vaccine, there are so many people who are concerned about its safety. There are people before the pandemic even that didn't trust vaccines. With your decades of experience in this field, how do you convince people to take it?
This is a very exciting time of mixing science and capacity to generate this very promising product. Americans, once they see that this vaccine is safe, which we have every reason to believe, the Data Safety Monitoring Board, that independent board, did not raise any significant safety concerns. But critically, the Americans should know that it's 90% effective. That's talking about vaccine effectiveness getting close to what childhood immunizations are. if they've immunized their children, they should know that this vaccine is going to be effective like those vaccines.
How soon do you think it will be widely available for people to have?
I think the question should be, can we and do we have a plan working with states to get that vaccine to both the frontline healthcare providers and our most vulnerable Americans first, to protect and save as many lives? And those of us who don't have those conditions or are a different age may have to wait to that second phase of vaccination. But I think the American people should be assured that we can get vaccine out to those who need it the most within a matter of weeks and months.
I do think that your thoughts on the holidays are critically important as people prepare for Thanksgiving. What steps can they take in preparation for gatherings, if they do so plan to get together with their families, that they can mitigate the virus? Is it testing ahead of time? Is it quarantining before you get together? Or do you recommend not getting together at all?
You can test. You're right. You can ask family members to isolate and quarantine before they come. But do we want to take that risk in the last 45 to 60 days before we get our most vulnerable Americans immunized? Or do we want to take that extra step to really ensure that every single person is protected going into the January, end of December, January timeframe? We can really aggressively starting immunizing individuals and ensuring that our loved ones that we are grateful for and thankful for are there with us next year.
And Dr. Birx says she and other members of the coronavirus task force continue to meet daily. In fact, she writes a daily summary that she says she sends up the chain of command and leadership within the White House. She did not say if she is speaking with President Trump directly about her recommendations at this point in the virus. She says her obligation is to clearly communicate with the American people. And her message was strong today. This is the third time I've sat down and talked to her, and this was the most forceful I've heard her say it. Wear a mask, avoid crowds, socially distance, do those things. The next 4 to 6 weeks are critical.
And based on that, she's traveling the country a lot. It sounds like she says people are not doing it.
I think she's surprised because the message, she's been on message for months, and she is continually saying those things. And as she goes into communities, I do think she is a bit surprised. You heard her talk about lockdowns there, and I said, do you think we're going to go into a lockdown? She goes, lockdowns only work if people are willing to do those things. And she said, people aren't wearing masks when we're telling them. So she said, we need a more aggressive approach.
And Marty, just to reiterate, I mean, you know, those daily press briefings with the doctors and the president in the spring, that was kind of a staple of American life in the early days of the pandemic. We haven't seen one in months, even as the virus now is surging and that feared second wave seems to be here. Any indication other than going to the media about some formalized way to get back in the public eye so all of us can hear from the medical experts during a medical crisis?
It's critical, Rob, and I asked her that question twice. I didn't include it because she didn't answer that question as to whether or not they're going to go back to daily briefings. I think what's clear from my conversation with her today is she sees her best use of time in getting the message across is going to the media directly. They contacted us for this interview, and going out into the American public and talking to communities and making sure they're doing the things that they want to do. So I did not get the impression that you're going to be seeing any White House briefings on TV like we saw in the spring. This is the messaging now, at least from Dr. Birx.
You're pretty much saying the responsibility is on all of us.
Absolutely.
Advice, right?
And now is the moment. Now is the time to do those things.
All right. Good interview. Thank you, Marty.